It's been no secret that air pollution can harm your lungs. However, it may surprise you to learn that the smoky air in the winter and the haze in the summer could be damaging to your heart. That's right, researchers continue to find evidence that exposure to air pollution causes heart disease. And one Valley cardiologist has made it his mission to get to the heart of this serious issue. Meet one of his patients who is taking those warnings very seriously.
Hey, hon, do you think it's time to maybe put some more pellets in the stove?
Ron Merwin had an aortic valve replacement and does what he can to stay heart healthy.
It's really important, and I'm very conscious of it because when I don't have a problem with shortness of breath and things like that, but when I do, I realize that the air has a lot to do with it.
Merwin has installed a cleaner burning pellet stove and made other changes in his home since his doctor told him exposure to air pollution can pose an even greater health risk of death from heart disease than from respiratory disorders.
The oxygen goes in, it's got to go someplace, and so if it gets plugged up, so you already think about that when you've had your heart overhauled. So those are important things. So it has a real impact on whether you're going to walk up straight or lay down flat.
I'll talk about some of the biological mechanisms on how this happens.
Dr. John Tellis is passionate about the topic, seen here giving a seminar at the Fresno Heart and Surgical Hospital.
We just looked at a population of people. Individually, it would reduce life expectancy by about 3 years. Being exposed to the level of pollution that we are exposed to in the San Joaquin Valley.
According to Dr. Tellis, the population in our area with cardiovascular disease, from hypertension to heart failure, is even larger than the asthma population.
We have a large group of people who already have established cardiovascular disease who have an added-on risk factor that they can't escape. That's the problem with it. I mean, you can improve your cholesterol, you can improve your blood sugar, you can improve your blood pressure, but you can't escape the air that you breathe.
There are several types of pollution, but the particle pollution, also known as particulate matter, which comes from motor vehicles, wood burning, fires, power plants, and coarse dust particles stirred up by vehicles, poses a serious threat for those with heart disease.
The ozone may be worse for development of acute asthma attacks, but actually the small particles is probably worse as far as mortality, and especially coronary mortality.
That's one of the reasons Ron prefers to rake his leaves instead of using a blower, and he pays attention to when it's a bad air day.
He really has a real sensitivity to the air, and so on days when it's not that great, he just doesn't go outside and do much. He just sort of stays inside and does inside things.
One of those things is checking to make sure the filters in their home are changed frequently.
We have 2 filters on our system, one in the main part of it and one in the back half of the house, and I check them every month, and I date them when I put them in, so you don't, well, yeah, I must have just changed it. No, you changed it 3 months ago, so that's an inexpensive way to try to keep the air clean.
Dr. Tellis says an easy way to gauge whether or not you should be exerting yourself outdoors is to use the Air Quality Index. This gives you a color-coded guide to help you understand the levels of health concerns on any given day, empowering you to avoid activities outdoors when the air is harmful. It could save you a trip to the doctor.
There's about 5 or 6 studies that have indicated that on days of increased particle air pollution, there's increased frequency of heart attacks, increased admissions to the hospital for heart failure.
Ron and Dayreen found a good air day to get a walk in. Since exercise is an important part of keeping a healthy heart, they're smart about planning their exercise. Ron says it's helped him pass the doctor test.
He said, just keep doing what you're doing, so I'm going to keep doing what I'm doing, because obviously it must be working.
Ron and Dayreen have made some great changes in their lives that not only impact their health, but help their pocketbook, too. Dr. Tellis will be speaking on this issue again at the Fresno Heart and Surgical Hospital on February 21st at 6 p.m. It is free, but seating is limited, so call 559-433-8014 for reservations. For more on this issue, visit our website at medwatchtoday.com.